Hi, welcome to Livingston Community Health's Locum training. Attached, you'll see the agenda for what we're going to be covering today. This may change a little bit, but it's a general overview of what you're going to learn in the class. I'm going to open up our Nextgen test environment for training purposes. And we are going to begin learning how to navigate through Nextgen. So the first thing that we need to look at is how to log in. You will need to log into the Nextgen icon. You will see an icon that says Nextgen 5. If you double click on it, it will open. We're mostly going to be going into the EHR today, which is the electronic health record. That is where the providers and nurses do their clinical documentation. So if you single click on the EHR icon, it will take you in. Okay, so I am currently in a test environment. Whenever you're playing around in Nextgen, you'll want to be in test, but if you are documenting live on real patients, you'll want your database to say ngprod. You will be taught how to do that, or if you have any questions in your live training. So now we're going to put in our username and password. And log on. So whenever we first log into Nextgen, none of our preferences have been set yet. So a little bit later on in the training, I am going to go through how to set your preferences. But what is going to happen now is it will prompt you to select the location where you're seeing patients. For today, I'm just going to select Livingston Medical Group. And then you can select the provider. You should be able to find your name in this list. You could type in your last name and do a search, or just scroll down and find your name. If you don't see it, you may not have been set up yet, but just let somebody know during your live training. Okay, so now I am in the Nextgen EHR. It doesn't look like I really have anything here, and the reason for that is because I don't have any patients open. So what we're going to do is open a patient, and then we're going to go through some of the different menu bars that are available. So to open a patient, we can click on the patient button. And search for our patient. So the patient can be searched for by their last name, or if you happen to know their medical record number or date of birth, you can search by those fields too. So for training purposes, I'm just going to search for someone with the last name Test. And then I'll just go down a little bit further and choose someone. Okay, so you can now see that my patient is open. There are a few different ways we can know that we have a patient open. Even if I close out of this bar on the right, you can still see that I have a patient open because I can see the name here, and also I can see the name up at the top. We can review their name and date of birth and age and medical record number. So let's now just go through some of these title bar items. So the logout button is if you wanted to lock your screen. So you wanted to maybe just step away from your computer for a minute, you could press the logout button so that whenever you log in, you're going to come to where you left off on. However, you may want to also log out of Windows completely, but this is just if you wanted to log out of Nextgen only. To actually fully get out of Nextgen, at the end of the day, or if you were fully closing out of the application, you could go to the File menu and then exit, or you could click on the red X at the top right. Okay, there is the Save disk. So whenever you're working on templates, you may want to periodically press the Save button. Just so you know, Nextgen is really good about saving things. So if you are placing an order or closing out of a pop-up or things like that, the application will automatically save, even if you're just moving from template to template. A lot of times, if the system does happen to kick you out, it won't actually make you lose everything that you were working on. Even if you forgot to press save, it probably did save it somewhere along the way. There's also the clear button and the delete button. These two fields are what we selected whenever we first logged in. So if you only work at one location, you can set a preference to always have this default. And also your name could always be defaulted in the provider field. This is two parts to the 4-point check. So you should perform the 4-point check before you begin any documentation. So you should check the patient's name, the location, the provider, and also the encounter date and time. That will ensure that you're not accidentally documenting on the wrong patient. Maybe you're not documenting on the wrong provider or the wrong location or under the wrong date, because all those things can happen. And it will cause issues in billing if you were to submit under any one of those incorrectly. The patient button, as we looked at earlier, will prompt you to open up a patient. If you already have a patient open, like we do, and you click on the patient button and search for a new one and open them, it will automatically close you out of the patient that you're currently on. It will prompt you, though, to save whatever you are currently working on, so you don't have to worry about losing anything. You just can't have two patients open at the same time. The history button will toggle the history toolbar on the right-hand side. So the history toolbar is going to show you a history of all the times the patient was seen. So all these different folders, these yellow folders, are showing you different times somebody documented on the patient's record. And it will show you who the rendering was on each of the visits. We are in a test environment, so we have some things that say conversion T provider and CPSP worker. So you may see more providers' names in the live environment whenever you're working on them. Within each of the encounters, you're going to see what was done. So these are templates where a provider inputted information. So you could click on each of these and see what type of documentation they did. The paper at the bottom is actually going to show you a summary of what was entered into some of the templates. So if you see something called Master IM or Master Document or Chart Summary, that will summarize what was done during the visit. That can actually also be printed or faxed, whereas the templates are just for inputting the information. Okay, the next icon we're going to look at is the inbox. We will cover this in a little bit more detail later, but your inbox is going to show you three things. The first thing it will show you is your appointments for the day. So if you have your name selected here and put a check mark next to it, you will see all of your appointments. On the right-hand side, you will see tasks, which are messages that can be sent to you from your coworkers. For example, if a patient calls in and they have a question for you, but you didn't take the call, somebody else did, they could document what the patient needed from you and send you a task. Down at the bottom, you will see your patient portal messages. And if you don't see this listed down here, you can click on your settings and you might be able to get to it. Or here, and instead of having inbox, you click on patient portal and it will appear. The patient portal is where the patients can go online and send questions that they have for you. They could send medication refill requests. They could even send appointment requests to your front office staff. So lots of different things happen with the inbox, but we will look at it in a little bit more detail later. The next icon is your PAQ. That stands for Provider Approval Queue. It is where you will go to sign off on things. You may not be using it that frequently, but I would still log in to monitor it every once in a while. It is where lab results can go to be signed. It is where visit notes will go to be signed, so your summary of your visit for the day. You can sign things as you're in the patient's chart, but if you forget to sign something, it will be sitting there, so it's just sort of a little reminder that something still needs to be done on the patient's record, or you still need to finalize their visit. PM stands for practice management. That is where your front office goes to schedule appointments for the patient and where your billing team goes to process the claims, not something you will really need to do. ICS stands for Imaging Control System or Document Management. It is where your medical records department and also your front office staff can go to scan things into the patient's chart. I will show you in a little bit where you can go to view the things that are scanned in. You won't have to go to ICS to do any scanning. These are the different module buttons. They are the same things that are located at the bottom of your history toolbar. So in a few minutes, whenever we cover the history toolbar, we will go over those at that time. The only difference is the EDR, which stands for Electronic Dental Record. So if you happen to see patients or if you just want to check a history of their dental records, you could go into EDR to see that. If you have any more questions about EDR, that can be covered during your live training. So the next thing that we're going to move on to today is setting our preferences. So to set our preferences, we will go to the Tools menu and then down to Preferences. So you will want to make sure that you're doing this in your live environment whenever you log in. You may want to take notes on this so that you remember what to set, or be sure to ask during your live training, but it is something that has to be done before you start seeing patients. It will make your life easier. So the first thing that I'm going to have you set here is your initial module. So on your General tab, Initial Module, let's go down and set that to Workflow. What that will do is whenever you first log into the system, you're not going to log into a blank screen. You're going to log in and see your inbox appear, which will show you your appointments for the day, your tasks, if anyone sent them to you, and any patient portal messages. Let's move on to the next tab, which is Main Toolbar. Your main toolbar is referring to this toolbar over here on the right, your History toolbar. So our default view is going to be Encounters. That is the patient history. It's not going to default to their demographics or categories. Let's also go to the Encounter Display. So if you click on the button that says Encounter Display, it will take you into here, and it will show you how your encounter is going to look, the title of the encounters. So if you want to make it maybe a little bit more condensed, the date, you could condense it a little bit more. If you don't want to see the first, middle, last name, and degree of the rendering provider on the visit, you may just want to see last name and first and middle initial, for example. And we will want to make sure that at least remarks is checked. Location is good to have checked too, but at least remarks. And press the OK button. Okay, another thing that we want to change in regards to our patient history bar is where it says Expand All under the Encounter display. If you click on that drop down, you'll see where it says Expand Most Recent. I like to have that one selected so that it's a little bit more neat. So that the most recent encounter we're working on is expanded, but then the rest of them are condensed. As you can see now, everyone I have is expanded, so I would have to do a lot of scrolling to see previous visits. If you have Expand Most Recent, you won't have to do as much scrolling, and you can just open up the one that you want to see. The next thing I want you to make sure you have done is to check Billable Encounters. It's important to have billable encounters checked so that the appointments from the practice management side are visible in your history toolbar. This setting is very, very important, or you will not see the encounter appear when the patient checks in, and then your 4-point check might not happen. It won't be accurate. Okay, moving on to the next tab is medical records. This is what I spoke of earlier when I said if you work at one location and you are the provider, you can set your default here so that you don't have to choose it every time you log in. So if you click on this 3-dot button and find the location that you work at, you can select that there. Now, if you are going to be floating from location to location, you may not want to set a default because then you might forget whenever you arrive at the other location. So it's up to you on if you set a default and then you want to maybe set it at the beginning of every day. You could come in here and change it if you are moving around from location to location. But I might just leave this blank if I were you so that you are prompted to select it every time, just so that you're not accidentally choosing the wrong one. However, like I mentioned earlier, if you always work at one location, you will want to put that location here. And also the provider name, you will most likely, I would think, always be documenting under your name, so you would want your name to be in the provider field. Let's then move on to templates. Templates are your default templates. Templates are where you go to document your patient information. So there are so many templates that you have available, and we don't want you to have to scroll through and get confused potentially on, which one to select. So it is important that we have preferred templates so that you know that you're documenting on the right ones. So the intake template is where an office visit always begins, and a SOAP template is typically where the provider begins. So your nurse or medical assistant may start on intake, but then whenever you come in, you'll start on SOAP. So it's okay to have both in here as preferred templates. Also, telephone communication is a good one to have as a preferred template. If you are not sure how to add it, you just click on it on the left-hand side and press the arrow, and it will move it over to the right. As you use the system more, you may find other templates that you find very helpful. For example, we won't be covering this today, but there is a template called the Provider Test Action Template, and that is where you could go to document your plan based on results that are coming in. Just something to consider, but these are definitely the 3 that you would want to have as your preferred templates. Let's then go to medications. So for medications, we could set a default printer if you are always working at one location and maybe there's a special paper for prescriptions that you want. There are some other things here, but we aren't going to set any of those at this time. Let's then move on to Formulary. So the Formulary is really nice whenever you're searching for medications. The Formulary will actually show you if a patient's insurance covers the medication and also what the copay will be. It does not work on all insurances, unfortunately, but it can be helpful if it is working. We don't have to set it as the default search, though. You can switch it over whenever you are doing your search manually. The rest of the settings we aren't going to go in and change. So we're finished setting our preferences, and we can just press the apply button and OK, and that means your preferences have been set. Okay, so we just finished going through preferences. So the next thing that we're going to talk about today is the inbox. So let's go back up into our inbox, which we did look at this a little bit earlier, but let's click on it again. Okay, so let's start off by talking and reviewing the appointments, which is on the top left. So our appointments window is very nice and can show you lots of different things. It will show you the time of the patient's appointment. If your nurse is updating what room the patient is in, it will update the room number where the patient is. It will give you their name and why they're here. And if your front office is putting in a little bit more detail, the reason could also be changed. The status will also change. Once the patient gets checked in, the status will change from booked to kept. The booked status means that the patient simply has an appointment. Once the status says kept, that means that they've arrived at the front desk and the front office person's checking them in. That is the cue to your MA or nurse to go to the front and bring the patient back. I am going to go through an example of that in a little bit. If you want to view previous or future appointments, you can do that by changing the date. If you want to see other providers' schedules, you can. You can just click on the check mark here and it will show you, which I don't have any others, but it will show you other people's appointments. The gears can have you refresh your appointments. If you don't want to see canceled appointments, you can uncheck that so that you don't have to see them. Canceled appointments will display with a line going through them. Let's go down to the preferences here, and we can go to refresh appointments every 5 minutes. That is so that you won't have to refresh the screen yourself. Also, so you can see here, whenever the nurse says that the patient is ready, the text will actually change to green, so that's another indicator that the patient is ready for you to see them. Let's press the OK button. So we spoke of tasks a little bit earlier. We said that they're messages that you can send to and from each other. We can manually add tasks from this screen. However, most of the time it's going to happen as you're working through a patient's record. So the chance of you coming here and pressing the add button to manually task somebody is probably not going to happen very often. As I mentioned earlier, whenever someone is doing a telephone call, that's an example of when they may task you. If you're ordering an immunization on a patient and you want a nurse or medical assistant to administer that immunization, while you're ordering it, there will be a prompt so that you can task somebody. You, as I said, will not really have to come in here to create your tasks. And as we're working through the system, I'll show you examples of what it looks like to task your users. Let's close out of this and then look at our patient history. We'll now move on to the next part. So because I have locked encounters here, you can see that there's the lock symbol next to them. I can't really go in and make any changes. These are from July. These are actually from 2016, so these are from a really long time ago. But I can click on it and view what was done. But once it has the lock symbol, you can't make any changes. So this patient doesn't really have too much information in here. Maybe I'll go to another one and see if there's more. Let's maybe go to this intake and see if I can find more things to show you. So I do have a reason for visit. I have a historian field. So if I did want to come in here and make changes, we couldn't. If I click on a field, it doesn't let me do anything or make changes. Okay, you can see that it says that it's read only. So the way that I can document on something is, or the only way that I can document on something is if I have an unlocked encounter. You will not have rights to unlock an encounter, so there will have to be an encounter here. When a patient checks in through EPM, an encounter will automatically get created. And that I'm going to show you a little bit later. But for now, I'm just going to go through some of the different functionalities that are on the history toolbar. So I'm going to press the new button so that I have an encounter for here today. You will not want to press this new button, especially if the patient is coming in for a visit, because then you will have two encounters the same day, and billing could get very confused with what's happening. It will actually make a little bit of a mess for them to clean up. The only time you should press the new button is if the patient is calling in for a telephone call and you're the first person taking that call, Or if you're doing a chart update, so maybe the patient is coming in tomorrow or they're coming in a week, and you know that there's a lot of information that you want to get documented and abstracted. For example, putting in their medication list if they're a new patient that's being seen, or you want to put in a list of their chronic problems, things like that. But we do have a new encounter here, and we will begin to show you some of the different module buttons. So this isn't how you're actually going to be going through and seeing a patient on a day-to-day basis. Right now, this is just showing you some of the functionalities that Nextgen has. So I will expand this just a little bit more so that we can see more of what it says here. And earlier I said that we could have remarks on these encounters. So I'm going to show you how to do that. This isn't a requirement, it's just something that's nice. If you right click on the encounter and go to encounter description / remarks, I'm going to, for fun, just call this history toolbar overview. So you could imagine what you could do whenever you're actually seeing a patient. You could change it to physical exam. You could change it to sick visit, immunization visit. You could give your encounters names so that you don't have to open them up and read about them to figure out why the patient came in. But let's click on the OK button, and then I'm going to refresh it so that you can see what it looks like. So here it is, history toolbar overview. So I'm sure you can imagine how helpful that would be to actually have your encounters named for the reasons why the patients were seen or the types of visits. Let's now look at some different things like the templates button. So the templates button is the one that you're going to be accessing very, very frequently. If you click on it and then go to intake, this is the template and the flow that your nurse would actually take whenever they're bringing a patient back. So the first thing that we need to select is our specialty. And let's select family practice. And the visit type, we'll select office visit. So again, this is something that your nurse is going to do. They will choose the specialty and the visit type. And depending on what they choose, different things will appear. So if we were to choose a different specialty, something else would appear. We would have different templates or different options would be available. And the visit type is important because if you were to select something else, the billing code that gets submitted would be a little bit different. Okay, so this is really just an example of a template. We are going to go through workflows, but not quite at this time. So let's close out of our template. And yes, I will save changes. And the next button that we have down here, the next icon, is your document module button. So a lot of these module buttons you're not going to access directly, but as you're working through the templates, these items will be addressed. So I'm going to show you the document module button, even though it's not something that you're really going to access in real life. The document module button will show you all the documents that are available in Nextgen. Documents are what I said that can summarize what is in the templates, and the documents can be printed or faxed. So it is very important that you are generating a few documents whenever you're going through and entering information in your templates. So you wouldn't come in here to generate a document, but let me show you. If you're on your intake template or your nurse is on the intake template, they might finish their documentation and then select the generate intake note. So that will generate a document and they don't have to go here. It's just a button that's available for them to choose, and you will see a lot of that in your workflow too. Okay, because we didn't document anything, there's really not a lot of information on here. But let's close out of our document button. The next icon we have is our image button. Again, something that's not really going to be used too frequently, but I will show it to you quickly just so that you're aware that it's here. These are generic images. So let's pretend that this patient maybe had a strain in their underarm or something like that. Or, a better example is if they were to have a mole removal or something along those lines. You could come in here and, draw a circle. It's very similar to paint. And then just go to your text icon and type in lesion or something, just so that you remember where it was. And if you save it, you can then have this on your history toolbar, so if you ever wanted to refer back to where it was, you could have this here. Again, I don't really see it used that often, but it could be helpful. The next icon you will see is your procedures module. So anytime you're in the patient's record and you are submitting a code or a charge, a CPT code, the procedures module will be updated. So let me show you an example. So your nurses may go to standing orders. And let's say that maybe they're doing a rapid strep test and the result was positive. I will then select place order. And sorry, I forgot to close it. So we'll press the red X and it will close. So now let's look at our procedures module. The procedures module is updated with the rapid strep that I just did. So a lot of times whenever you're placing orders for things, or if you see a button that says submit to Superbill, you will want to make sure that you're doing that so that your charges are getting submitted correctly. If you put a code in, but maybe don't place the order or submit to Superbill, it won't actually get processed into your practice management system. So this is a place that you can go to confirm that your charge was submitted. The next icon is your problem module or your problem list. Anything that you diagnose the patient with will be a part of your billing ICD list. So you can see that I have that encounter for screening. That was my strep. If I go to my problem list, these are problems that I want to manage. These are their chronic problems. I can take something from my billing list and add it to my chronic list. So I don't know if this patient has anything. I don't believe they have anything that would make sense. But if they did, if I wanted to make that a chronic problem, I could click on it and set to chronic, and I could send to my problem list. Then it will be on my problem list, and I could always manage my problem list. So these are problems that you would want to track on the patient. The problem list, like every other module that we've gone through, is connected to a template. So if we go to histories, I will show you the field that is connected to the problem list. Here it is. Histories is the second tab, problem. So this list is connected to this module. Also, whenever you are diagnosing your patient during your assessment at the end of the visit, that will automatically update your problem module. Okay, moving on, we have the flower icon, which is your allergies section. So I'm going to go back to our intake so that I can show you the connection between the two. Okay, so scrolling down, this is the panel that says allergies. This patient has indicated that there are no known allergies, so there is a check mark there, but I'm going to uncheck that because I want to show you how to put an allergy in. So while your nurses or you are working through the patient's chart, you could go to update here, or we could go to the flower icon and add in an allergy. So it went away because we originally said no known allergies, but then we resolved it today by unchecking it. So let's go to the search icon and then type in penicillin. Okay, here it is. If we type in something and we don't find it, you may want to try selecting the Contains Radio button, and then let's press OK. If we know the reaction that the patient has, you can click on your drop-down arrow and select the reaction, and then add. So now penicillin is listed as an allergy, and it will show you the date that it was entered in. I can close there, and then I would have to refresh this, which I can save. Let me close it and reopen it. And here it is. There's the penicillin. If the patient comes in and they say, yes, I'm allergic to penicillin and that is the only thing I have, and you already have it in there, your nurse or medical assistant will select the reviewed no changes. Let's now look at the medication module. This one, you really will just be monitoring it for the most part from here. You can also get to it within your template, but there's not a lot that happens in the template. Most of it happens within the actual module. So to put in a medication, whether you are prescribing it new for the first time or another doctor prescribed it, or maybe it's a vitamin, the only way to get a medication into the patient's record is by pressing the Prescribe New button. So we'll click on Prescribe New. You will see that we have favorites lists that have already been created. So you can go to the favorites list and select a medication from here. However, you can also do a search in the Find area. So let's say that the patient says that they are on Prilosec. So we can select that and then double click, and it will add it down to the bottom. Maybe the patient also says that they're on aspirin. And they told you that another doctor prescribed them Lipitor. And they don't remember how much they're taking. They just know that they're on it. Okay, so let's just select one and I'll show you what to do. So we'll press the select button. And now all of these medications are listed as temporary. So they're not inactive and they are not active. They're just sort of in this middle holding ground. So they want us to address it. So the Prilosec is something that maybe we prescribed, or maybe we know how much it is. I don't know. But let's review this. Take 2 capsules by oral route 1 time every day before a meal. To be compliant with Joint Commission, I'm just going to say instead of oral route, I'm going to say by mouth every day before a meal, and then select done. And let's just say for fun that I am prescribing this today. So I want to give the patient 30 capsules and the duration that they're going to take this. Maybe I actually want to give them 60. And the duration is 30 days. And then what will happen is it will automatically give it a stop date. And it will then, after this date, move it into an inactive, and we will have to renew it. So the patient would have to come in, or we would have to decide to renew the medication. And let's accept. Now this is the Lipitor. This is the one that the patient said that they know that they're taking, but they don't know how many milligrams they're on, but we really want to get it in there in case there's any interactions. So you click on here and select unknown strength. Okay, Lipitor. Now it doesn't have a strength next to it. And then you will also see that the prescribed elsewhere checkmark got checked. Now you're not going to be able to send this med or fill it for them unless you renew it and put in a strength and accept. And then the aspirin, maybe they decided to take it and you want to make sure that you know that they're on it, but you're not really responsible for prescribing it or telling them to take it. So you're going to say prescribed elsewhere because you still want to be sure that you know they're taking it. And then let's accept. Okay, so that was the prescribed new. So you'll see that print and send are grayed out. That's because we said it was prescribed elsewhere. But this one we actually could print or send it. The send button is to send it electronically, so e-prescribe it. Renew, that's what you would select if a medication was inactive and you wanted to fill it. So you can renew and just send it, or you can edit the prescription. The interaction check will run. So we said the patient was on penicillin. So let's just say that we want to prescribe them that. Sorry, I know this is crazy, but we'll just select that one because it is a penicillin and select, and let's try to accept this medication. Oh, a SIG is required. I would hope that you guys know that this isn't how you would actually do it, but we have to have something in there. And accept, and we should get an interaction check. That may have been that first alert that popped up. Let's click on interactions and select all. And this might be because it's a little bit different. Sorry, I thought that this would give me an alert here. It may have been the first one, but I thought that we would get something else too. Okay, if we don't want the patient to take something anymore, or the patient stopped it because it made them feel sick and we want to then, try something new, we can click on it and then press the stop button, and then it will move it to an inactive medication. If something was entered totally by error, so we put this medication in and we really shouldn't have, we can sometimes press the delete button to remove it. Not everybody will have delete rights, but let's press delete, and I'm actually going to remove that one. The RX eligibility is going to run if you want to get the patient's formulary information. So because this says pending, that means that we haven't checked our patient RX eligibility, but we are in a test environment. So that might be the reason why we're not seeing, and it probably wouldn't work actually. We could try real quick. Okay, I'm going to close because we are in test and on a test patient, so I don't think it would work. But the RX eligibility will check the patient's insurance to see what meds are on their formularies. Okay, so this is basically it for your medication module. Let's close out of that. And the last one that we're going to look at is the orders module. So the orders module is where you're going to go to order your immunizations. Oh, sorry. Immunizations will eventually be ordered here. Currently, they are ordered in a template, but they can be ordered from the orders module. If you have any questions, you can ask that during your live training, but I know that labs will be ordered here. Immunizations may be. And by the time you're seeing this video, immunizations may already be ordered from here. So just an FYI, but I won't be covering it. I will show you, though, how to order labs from here. So let's go to the order summary. So the order summary is going to show you a history of everything that was ordered. So this patient, they did actually go in and do a Gardasil for an immunization. And then they also ordered a chlamydia test. So let's pretend that we want to order a lab. So let's click on the lab button and then select New. Livingston Community Health is connected to a Quest interface. So whenever you order something from here, it will process through to Quest and the results will come right back into the patient's chart and you will get notified in your PAQ. Okay, so we have Quest selected at the top. We will choose a diagnosis or a reason why we're ordering the lab. So let's say that we're doing it because of, it could be one of these, or we could do a search all and just do a search for a diagnosis code for why we're ordering a test. Sorry, my screen resolution is a little bit off. But if we were to do something like hypertension, and then I pressed enter, you could press search, you could find it here, and then press OK. And this is also now a reason, this 1I10, for why you're ordering your lab today. So we have these two codes. Medically doesn't make sense, but I know in your world it would. And put a check mark next to the labs that we want to order. So as you're putting check marks next to them, it's adding it to the bottom. If it is going to put check marks next to both diagnosis codes, if for some reason it doesn't actually go along with both, it just goes along with the other, then you can choose to select and unselect them. Let's then go to the General tab. Your name could be selected up here as the ordering provider. Let's then scroll down, and if this patient had insurance, they may want to have the insurance as the selected insurance. That is probably something that you will not have to do, but just as an FYI, you can see that the insurance could be there. Also, for test details, if the blood is being drawn in the office, somebody from the office will go in and indicate the collection date of the blood. But as far as you're concerned as the provider, you will just need to come in here, find the diagnosis, select your labs, and press the save button. You could also do a save and send if you wanted to send it directly to Quest. So let's press the save. And then do a refresh. And our order should show here. I might need to close the screen and reopen it. Or it might just be because we're in a test environment. But you should see your order here, and the Nextgen status should say ordered. Okay, so that is all we are covering for now. Our next session is going to be workflow.